This morning we're joined by Dr. David Jacobi. He is a psychologist and clinical director for Rogers Behavioral Health in Sheboygan. Doctor, good to have you up early with us this morning. We have to start with COVID, so let's do that. You know, we've heard many parents tell their local school boards that for their children, wearing a face mask has been detrimental to their children's psychological health, even unhealthy in some cases. I wonder first if that's been your experience and something that you have observed, and then regardless, where school districts have this masks optional, how should families approach that with their children?
Well, I think it sort of depends on the age of the child. So very young kids, we certainly want to be appropriately reassuring about the fact that teachers and other adults will be kind of taking care of them, making sure that they're safe. When we kind of move into that middle school age, again, we're trying to reassure them they're going to be okay, but also understanding the impact of their behavior on other kids, teachers, and so forth. And then as we move into adolescence, we can have a more detailed conversation about the pandemic, about COVID, about the CDC guidelines, requiring masks and so forth, so that they have a better and richer understanding of this.
Dr. Jacobi, the mental challenges for kids in this past year has been well documented. I'm wondering, I have a 16-year-old son. A lot of times it's hard to even get 2 words out of him. And I think that's the case for a lot of parents of teenagers. So as parents, how do we make sure that our kids aren't just being, their typical teenage self, and that there is something more going on where they may have increased anxiety because of everything they've had to deal with and as they look ahead?
Yeah, what we do know, and first to kind of set the stage here, the Journal of the American Medical Association in their August issue looked at the prevalence of anxiety and depression among 4 to 17-year-olds, and they found that 25%, or 1 in 4 of youth globally, are experiencing clinically elevated depression symptoms, and about 20%, or 1 in 5, are experiencing elevated anxiety symptoms. What's really interesting about this is roughly double of what these estimates were prior to the pandemic. And even at Rogers Behavioral Health, we're seeing roughly an 8% increase in the number of admissions to our child and adolescent program since COVID started. So how do we know that this is something that we need to be concerned about? I always encourage parents to have that conversation with your child, before the school year starts or as the school year starts. Do it in an uninterrupted fashion, right? So go grab an ice cream cone, go out in the back and shoot hoops, or do something like that where you just have your child's attention and ask them, what are you looking forward to with this new school year? What worries and concerns might you have? Right? It's an opportunity to kind of open up and talk about these things. And then for parents, I really don't want them to dismiss any of those concerns, but to what we call validate. Show that you understand, or that you're trying to understand that child's experience, and then potentially help them, right? We can do some problem solving with the child if they have concerns about academics, performing well at school academically, if they have concerns about interacting socially or bullying, things like that. So working with the child to come up with some solutions can be really, really helpful in allaying some of those concerns that they have prior to going to school.
Terrific insight there. Dr. David Jacobi is psychologist and clinical director for Rogers Behavioral Health in Sheboygan. Appreciate your time with us this morning, doctor.
Thank you.